Bismillahirrahmanirrahim. So today we will discuss the submandibular salivary gland. Submandibular salivary gland is one of the salivary gland that is present in the submandibular triangle, or also known as the digastric triangle. You can see this is the submandibular salivary gland. The other salivary glands, they are carotid gland and sublingual salivary glands. You can see it is roughly J-shaped, and it is present in the digastric triangle, and it is indented by the posterior border of the myelohyde muscle, which divides this gland into larger superficial part and a small deep part of the gland. It is enveloped by well-defined capsule, and the duct, the excretory duct of this gland is called the Wharton's duct, that opens into the floor of the mouth. It's a mixed gland with both serous and mucous secretory units, and the parts of this gland, they are the larger superficial part and small deep part of the gland. Myelohyde muscle divide this gland into superficial and deep parts. Again, you can see this is the myelohyde muscle, and this myelohyde muscle, it divides this gland into this larger part, that is the superficial part, and the smaller part, that is the deep part of the gland. This is the Wharton's duct, or the duct of the submandibular salivary gland, that opens into the floor of the mouth. Superficial part and deep part of the glands. As far as the surfaces of this gland is concerned, we have lateral surface, we have medial surface, and we have inferior surface. So three surfaces: lateral, medial, and inferior surface. And we have two ends. One is the interior end, and the other is posterior end of this submandibular salivary gland. Superficial part is wedged between the body of the mandible and the myelohyde muscle, and reaches superiorly to the myelohyde line on the mandible. Posterior to the free margin of the myelohyde mucous membrane of the mouth lies. Superior to it extends to the angle of the mandible. Interiorly reaches the level of mental foramen. Gland, as we have discussed, that it is enclosed by a deep fascia, and this deep fascia has two layers, and it is the cervical fascia, deep cervical fascia. Superficial layer is attached to the inferior border of the mandible. The thinner, deeper layer is attached to the myelohyde line. Posteriorly, these layers fuse in the stylomandibular ligament, which separates the submandibular gland and carotid gland. Relations relations we will discuss the inferior surface relations, the lateral and medial. Inferior surface is related, it's covered by skin. Then we have superficial fascia, which contains the platysma muscle, cervical branch of the facial nerve. Then we have deep fascia, facial veins, submandibular lymph nodes. So this is the relation of the inferior surface. We have skin, then below the skin we have superficial fascia, then subcutaneous muscle, platysma, common facial vein, cervical branch of the facial nerve, this one, common facial vein, and investing deep cervical fascia. The lateral surface is related to the submandibular fossa on the mandible, insertion of the medial pterygoid and the facial artery, which grooves the posterior surface of the gland. The medial surface is related to the myelohyde muscle, vessels, and nerves. And the middle part is related to the styloglossus, hyoglossus, lingual nerve, submandibular ganglia, and the nerve, hypoglossal nerve. The posterior part is related to the styloglossus, stylohyoid ligament, the ninth nerve, and the wall of the pharynx. So this we have small deep part. The deep part is small in size and it lies deep to the myelohyde and superficial to the hyoglossus and styloglossus. These are the muscles of the tongue, hyoglossus and styloglossus. The duct of the submandibular salivary gland opens into the floor of the mouth. It is known as the Wharton's duct. Blood supply is through the facial artery and through the small glandular branches. And these branches are, of course, the branches of facial artery. The veins drain to the common facial or lingual veins. The lymph nodes they passes to the submandibular lymph nodes. So this was about the anatomy of the submandibular salivary gland location. It is present in the submandibular triangle, also known as the digastric triangle. Then the parts of the submandibular gland, two parts, superficial part, deep part, and it is divided by the myelohyde muscle, larger superficial part, small deep part. Then the surfaces, we have lateral surface, we have medial surface, we have inferior surface, and we have interior and we have posterior and then the blood supply, nerve supply, lymphatic drainage. Thank you.